Good evening, everyone. My name is Simiran, and I would like to welcome you all on behalf of Voice of Healthcare to Detect to Protect, a special breast cancer awareness campaign brought to you by Voice of Healthcare and supported by Zydus. This podcast series is designed to empower listeners with vital knowledge and insights on early breast cancer detection and cutting edge treatment options. In today's episode, we are honored to host Dr. Mounika Boppana, a renowned senior medical oncologist at KIMS Hospital in Secunderabad. Dr. Monica brings a wealth of expertise in medical oncology and is a passionate advocate for breast cancer awareness and prevention. She'll guide us through essential aspects of breast cancer, from the importance of early screening to the latest advancements in treatment options, helping us understand how timely detection can be a powerful tool in fight against breast cancer. Welcome to our show, Dr. Monica.
Thank you.
Thank you so much, ma'am, for joining us for this session where we all have gathered here to create awareness around breast cancer. And thank you for becoming one of our, strong voices in this. So, as we all are focusing on breast cancer awareness, and we know a lot of celebrities are being vocal, not only celebrities but also many people who are going through this treatment, or the breast cancer survivors are being vocal about what exactly it is and how is their life impacting, so that they can create as much as awareness they can. So starting with, breast cancer awareness is critical for life saving. So could you briefly explain why early detection plays such a crucial role in fight against breast cancer?
Early detection is very important in order to win the fight against breast cancer because it is proven and documented beyond any doubt that the earlier the stage of the cancer at the time of diagnosis, the higher is the cure rate. We can clearly see that in the 5 year survival rates of breast cancer when detected in stage 1 are almost close to 100%, whereas if detected at stage 4, where the cancer has already spread to other organs of the body, the 5 year survival rate is less than 25%. So we have a higher chance of cure, and not only that, but a higher chance of curing with lesser intensive treatment. The smaller the tumor is, we may not have to use chemotherapy in some types of breast cancer at all if the tumor is extremely small, which is the usual case when it is a screening detected cancer, which is very small. Because by the time the lump becomes palpable by the woman and she reports to us, it would have grown to a certain size. So, the earlier the cancer is detected, the higher is the cure rate, and also we can give less intensive treatments to achieve cure. The woman might just get away with a lumpectomy without even having to remove the entire breast. So that's why early detection is very important, and early detection saves lives.
You said it right, ma'am. Early detection saves life. As soon as a patient gets that suspect that she may be going through, or this lump could be cancerous, they should immediately go to and consult their doctors for this. And like you said, the cure rate is much higher in terms of early screenings. So I think
Right.
that's what we all are advocating for. So,
Correct.
ma'am, during when patients come to you, or they discuss, or you discuss about breast cancer or any kind of such awareness campaigns you're going through, so you would have, I believe, came across some misconceptions. So, what are some common misconceptions about breast cancer that you have often encountered?
There are numerous myths and misconceptions around breast cancer, which patients or even the family members keep asking us about. The first most important thing is that only painless lumps are the ones. If the lump is painless, then we don't have to go to the doctor. It is a harmless lump. And only if the lump is painful, then is when it is dangerous. So, this is one very important misconception that women have. In fact, most of the cancerous lumps are painless. So, if a lump is painless, then that is all the more a red flag sign that you need to visit your clinician immediately, visit an oncologist immediately, and get yourself checked. So, painless breast lump is very, very dangerous. Again, all painless breast lumps are not cancerous lumps. Most of the time, cancerous lumps are painless, or they may be associated with very mild pain or discomfort. So, that is one very common misconception that I find women telling us, and they keep telling us that because it was painless, we didn't do anything about it for about 6 months or 1 year, and now that it started growing so much, then only we report it. So they recognize a lump much earlier on, and because it's painless, they don't come to us. So that is a misconception. Painless lump is something that you have to be very, very alert about. The other thing is, again, all breast lumps are not cancerous lumps. There are a lot of non-cancerous lumps also. One of the most common non-cancerous lumps is a fibroadenoma. It's similar to a fibroid in the uterus. It's just a benign or a non-cancerous growth. Fibroadenomas, many women feel that if there is a fibroadenoma, it has to be removed surgically, otherwise it might become cancerous. Now, fibroadenoma is not a precancerous benign lesion. There are some lesions in the breast which are precancerous and which can lead to cancer ultimately, but fibroadenoma is not one of them. If the fibroadenomas are small, then they don't have to be removed at all. They don't have to be addressed surgically. We can just leave them alone only if the lump is very big and it is causing a lot of discomfort to the woman, or it's cosmetically quite disfiguring, or if it's causing a lot of discomfort, only then it needs to be surgically excised. And no medication works on fibroadenoma. There are a lot of medications being prescribed containing evening primrose oil and other so many other things, but they all don't cause fibroadenomas to melt away. As of today, there is no scientifically driven medication for fibroadenoma, and it's a benign lump. It's a non-cancerous, harmless lump. Nothing needs to be done about it. So that is another one. The other common misconception is that if there is a breast lump and if it's cancerous, if you do a biopsy, it will spread to other parts of the body. This is a very common misconception that people have, not only regarding breast lumps, but lumps in other parts of the body also. So, this is not the case at all. The breast cancer does not spread from a biopsy because of a biopsy. So, biopsy is very, very essential to establish the diagnosis of breast cancer and also to know the type of breast cancer that we are dealing with, because the treatment will be dependent on that. So, biopsy is very, very crucial to come to a diagnosis. FNAC, which is a fine needle aspiration cytology, is not enough to diagnose breast cancer because FNAC gets only a few cells. It does not get us tissue. We need tissue to diagnose breast cancer and establish the type of breast cancer. So one should never get, because we have many women coming from peripheries, coming from villages and towns already with an FNAC report in their hand. And we have to subject them again to an invasive investigation. We have to get a tissue biopsy done on the lump. Instead of that, when there is a suspicion of cancer, if the patients can be referred to a higher center where directly a biopsy can be done, because it's very difficult to convince a patient for a second test, because they feel that these people are just doing test after test and they're not starting any treatment. So it's extremely difficult to convince a patient for a second invasive investigation. So FNAC should never be done on a suspicious breast lump. It should always be a core needle biopsy directly. And biopsy is very, very essential. Doing biopsy on a breast lump will not lead to its spread. That is another message that I wanted to pass on in today's discussion. The other common myth that women have is if they get repeated mammograms done every year, like annual mammograms done, it will lead to radiation exposure of the breast, and that itself will put them at a higher risk of cancer. Now, that is completely a myth, because the amount of radiation that the breast gets exposed to in a standard mammography is just zero point 0.1 millisievert. It is so less, and it is well within the annual permissible limit of radiation exposure. It is lesser than what a person would be exposed to, the kind of radiation that a person would be exposed to during a dental x-ray or a standard chest x-ray, or the lot of HRCT chest scans which were done during COVID. So many people underwent so many CT scans of the chest during COVID. So compared to that radiation, the amount of radiation from a single mammogram is very, very less. So it's a myth that mammography leads to a significant radiation exposure which will cause cancers to form in the breast. That is again a complete myth, because many educated women, I find them avoiding mammograms for this reason, because they feel that it can lead to a radiation exposure, harmful radiation exposure. And the other myth that I find with respect to treatments is that women feel that if they undergo a lumpectomy or a breast conservative surgery, then they are at a higher risk of developing a recurrence of the cancer as compared to them removing the entire breast, which is called as the mastectomy. That is also a myth. The recurrence risk is equal with breast conservative surgery along with breast radiation, because when a woman undergoes just a lumpectomy and the remaining breast is left in situ, then the woman is also subject to radiation of the remaining breast, so that any few cancer cells which might have been invisible and left behind, they can be taken care of. So that makes its results equivalent to removing a complete breast. So if a lot of young women are presenting nowadays with breast cancer, they are in their 30s and their 40s, and it's psychologically very traumatic for a woman to give up a breast. So many people, many clinicians, and many family members, kith and kin, might be thinking this woman is more bothered about her cosmetic appearance and losing a breast rather than her life. But that's not the case. We have to give due importance to the woman's emotions and to the psychological impact of losing a breast. Just imagine telling somebody that we'll remove your hand surgically. How would they feel? So breast is similarly, breast is something that a woman needs to have to maintain her body image and to have that self confidence. So whenever breast conservation is possible, especially young women, we always encourage them, if it's technically possible, like the lump is small, it's not located exactly in the center, it's located a little outside or inside, it's not close to the nipple or areola. In these cases, we generally encourage them to go for breast conservation so that they'll be able to maintain a positive body image. And it's a misconception that if you undergo breast conservation, there is a higher risk of recurrence, because in order to reduce that risk of recurrence, we are giving radiation to the remaining breast. And the cosmetic results which we are achieving with current day plastic surgery techniques, breast reconstruction techniques, they're amazing. So it's very important for the woman to make an informed decision, and it should not be under the coercion or force of their family members that you just get it removed so that you will not have any stress or tension. So that is completely wrong, that breast conservative surgery leads to a higher risk of recurrence. And then there is another misconception that all breast cancers are hereditary. That is not the case, because we have many patients telling us that in our family there is nobody who has this cancer. I don't know why I got this cancer. Only 10 to 12% of the breast cancers in our country, in India, are hereditarily driven. They're driven by genetic defects. In some parts of the world, this percentage is a little higher, going up to 35 to 40%. But in our country, it's just about 1/10 of the breast cancer cases are actually hereditarily driven. So all breast cancers are not hereditary. A very small portion of breast cancers are hereditary. The remaining are all sporadic. Sporadic means they're not genetically driven, or they don't have any hereditary basis. And the other misconception which is there for cancer in general is that cancer is contagious. Cancer is not contagious, because it's not an infection. It doesn't spread from the patient to other family members, no matter how close contact they are in with, even among the husband and wife, between husband and wife also, it doesn't spread from one person to another. And also, if a patient in the household is taking chemotherapy, the family members ask us very often whether they can use the same utensils to cook their food, whether they can eat from the
Yes.
same utensils, whether they can use the same washroom. These are, some of the questions which are very commonly heard from the family members. So, a person who's taking chemotherapy, he or she will not affect any other family member because of that chemotherapy. In fact, their immunity will be less. So when other family members have infections like cough and cold, they have to stay away from the patient because they can infect an immunocompromised patient easily. But the chemotherapy that this patient is undergoing, or the cancer that this patient has, that will not affect the other family members in any way, no matter how close a contact they are with in the house. So that is another very important myth that we keep reassuring the family members. And also, patients feel that radiation and chemotherapy are very painful processes. They're not painful processes. They do have some side effects, but they're all temporary side effects and they are manageable with medication. So during the chemo infusion or during radiation, the patient will not have any kind of pain. Chemo is just like as good as taking saline infusion. through IV, and radiation, they won't even know that radiation is being given. It's just like getting a CT scan done. You go into the machine, you lay there for 10 minutes and then come out, the radiation is done. The patient wouldn't even know that the radiation is being given, because radiation is not something that can be felt. They're not like electric shocks. Many people feel that radiation is like electric shock, so they'll get the current shock like feeling whenever it's being given. That's completely wrong. Patient wouldn't know anything. A little bit of skin changes will be there after taking a certain number of fractions of radiation. There can be a little bit of darkening of the skin and some peeling of the skin, but as such, radiation is not a painful process. Chemo is not also a pain. It's not a painful process, and they do have some side effects after chemo, which are completely manageable. So these are the common myths that we encounter whenever we diagnose a patient and whenever we are going on awareness camps and screening camps. These are the common questions that people ask us.
Ma'am, you covered all such points so extensively and so in depth, and has given a proper explanation about this, because this is what we want to create awareness around. I believe you have experienced all this thing in practically, right? So that's why
Right.
you're able to address and pinpoint all those things in such an expressive, explaining manner. Because all those questions has came to you. But thank you so much for guiding the wider audience through this platform, and awareing our public about this, about such myths and misconceptions.
Yeah.
Moving on to the risk factors and preventions. So breast cancer can affect any woman, but some women are at higher risk than others. So could you highlight the primary risk factors that women should be aware of?
Yes, so the common risk factors which are the causes of breast cancer, or which put a woman at a higher risk of breast cancer, the most important thing is estrogen exposure, because breast cancer is essentially a hormonally driven cancer, and the main culprit is very high levels of estrogen. So women who have higher levels of estrogen in their body or are exposed to estrogen for a long time, they will be at a higher risk of developing breast cancer. Now, in a woman, the estrogen level begins to rise after attaining the period for the first time. That's called as menarche, which is at about 12 to 15 years of age. As the menstrual cycle starts, the estrogen level starts rising, and it keeps rising and falling cyclically according to the menstrual cycle. We all know that. And this goes on till the woman attains a menopause, where she permanently stops having her menstrual cycle. So that 35 years to of 35 to 40 years of duration is where the estrogen level is maximum in the body. So if somebody has had an early onset of the first period, like at the age of 10 or 11 years, or a late menopause, like they continue to menstruate, beyond 50, 55 years, then the duration for which the body is exposed to high levels of estrogen will be very long, because
Yes.
before attaining the first period, the estrogen level is low. After menopause, the estrogen level falls. So if early menarche, that is early attainment of period, and late menopause, this is a risk factor for breast cancer. And now late age at marriage and late age at having the first child are also considered to be traditional risk factors for breast cancer. Not breastfeeding a baby is also considered a risk factor for breast cancer. Use of artificial hormones like oral contraceptive pills, which are combined estrogen progesterone pills or estrogen only pills. There are different types of oral contraceptive pills which are used for birth control, in common man's language, birth control pills. But using it just for a few months or 1 or 2 years doesn't increase a woman's risk for developing breast cancer. If they're used for more than 5 years, their prolonged usage is what places a woman at a higher risk of developing breast cancer. Similarly, they used to use something called as hormone replacement therapy, or HRT, in postmenopausal women in order to reverse the effects of menopause on the skin, on the bones, and on the general well-being of the woman. So this was very much in vogue at one point of time, but they realized after conducting extensive studies in thousands of women who underwent hormone replacement therapy that the breast cancer incidence in those women was much, much higher than women who did not receive hormone replacement therapy, because the doses of hormones which are used in HRT are much higher than the doses which are used in oral contraceptive pills. So that's why, and they used for a very long time also, like they used for years together, 5 years, 8 years, 10 years. So that's why now HRT is no longer being used. So women who use hormones for a very long time, they are at a much higher risk. Similarly, obesity, if there's more body fat, because in a woman, not only estrogen mainly comes from the ovaries, but estrogen also comes from the fat in the body, from the peripheral fat. So, if a woman has more fat in the body, she is overweight or obese, then naturally her estrogen level in the blood will be higher. So, obesity is one very clearly proven risk factor for two cancers in women, mainly breast cancer and endometrial cancer. Anything that causes obesity in a woman, like lack of physical activity, having high fat, high carbohydrate diet that can gradually lead to an increase in the weight and the body mass index, these kind of diets also put a woman at a higher risk of developing breast cancer. And then we have genetics, which is very important. As I said, about 10 to 12% of the breast cancers are genetically driven. So if there is a strong family history of breast cancer or ovarian cancer, or if there is a family history of male breast cancer, then that is a very strong indicator of the presence of some harmful mutations in the genes which are involved in the causation of breast cancer. So that's why we take a family history whenever a patient comes. First degree relatives means parents or own siblings and children. If there is any history of breast cancer, then they are at a there is a high chance that they may be having a genetic basis for their breast cancer. So genetics is one very important factor. And the other important factor, which is irreversible, is age. The incidence of breast cancer increases with age. The risk increases with age, because as we age, our cells are subject to more and more damage. We know that DNA is the basis of everything in our body. So, as our DNA gets exposed years together to various kinds of insults, physical insults, infectious insults, chemical insults, so it keeps sustaining damage. Part of it gets repaired, but part of it may go unrepaired. And as it accumulates over a long period of time, once the woman reaches her 50s and 60s, generally that is the age when most of the breast cancers get diagnosed. Although nowadays we're seeing a very alarming trend of breast cancers being diagnosed at a much younger age. We're seeing patients even in their 20s and 30s getting breast cancer in very advanced stages. So that is something very unfortunate. Then lastly, we have environmental factors. So why are we seeing these cancers so much now? It was not so much heard of. We are
Earlier.
diagnosing more nowadays because of better diagnostic facilities. We are able to diagnose more breast cancers now. That is one factor. But there's actually an increase in the incidence of breast cancer, definitely. Okay, that is because there is, as I said again, more women are getting married late, more women are not having children, more women are having their first child at a later age, like in their 30s or beyond 35 years of age. So that is also a risk factor. The other risk factor is so much of chemical exposure. We don't know how all these chemicals, somehow they're entering our body through the food that we eat, through the water that we drink, through the air that we breathe. So many carcinogens, chemical carcinogens are entering our body, and probably they also are causing an increased risk of breast cancer. Smoking is a risk factor for almost every cancer that can happen in the human body, so it's a risk factor for breast cancer as well. And we are seeing a trend in India that many women also have started smoking. So this is more of a more was a problem in the West, but now it's a problem even in our country, that more and more women are beginning to smoke. So cigarette smoking, tobacco smoking is a risk factor for breast cancer, and it is an avoidable risk factor. See, age we cannot avoid. Environmental chemical exposures we may not be able to avoid. Genetics we don't have any control of. But what we have control of is maintaining an ideal body weight and also avoiding all the harmful habits like smoking. So these are the common risk factors for breast cancer.
You explained this so well, ma'am. And like you said it right, because of the nowadays the lifestyle we live, few of the things which we do not have in our hand, that is the environment, the genetics, and other few things. But the lifestyle choices, what to eat, what not to eat, whether to smoke or not, and all such things is in our hand. I believe there's this inclination towards the westernization, and that's why more and more people are adapting the smoking habits and all such things. But
Absolutely.
yeah, so this needs to be cut it down from our lifestyle, so that we see less of the cases of breast cancer. And like you also mentioned, because of the better diagnostics, better advancements in medical industry, the sector, it's easy to diagnose it at an early stage, or there are more ways to diagnose breast cancer. So since we talked about the screening of this, so there is this also thing, advancements in detection, right? So in recent years, what advancements have been made in detection of breast cancer that makes early diagnosis more effectively?
Traditionally, mammography, X-ray mammography of the breast has been the main screening method, which is an
Hmm.
approved screening method for detecting breast cancers at an early stage. Now we have more refinements in this mammography. We have digital mammography, digital X-ray mammography, where the images are of a higher resolution, and we can see even very trivial, minor things, extremely small cancers. Also, we can see more clearly than the conventional mammograms which were done a few years ago. And we are actually, there are other modalities of screening also which complement each other, like we use high resolution ultrasound of the breast also along with the X-ray mammography. When combined together, especially in young women, when we are doing screening, like women sometimes who are less than 40 years, also because of a strong family history, we might want to start screening them. Less than 40 years, what happens is there is a very dense breast in the sense the gland content is so much, which contributes to a higher density of the breast where small cancers can be missed. So in
Hmm.
such women, if we can use MR mammography, that is the, like, you know, the MRI of the brain, similarly there is an MRI of the breast. It's called as an MR mammography, so that can be used. And then we can couple it with high resolution ultrasound of the breast to look at, to get a better view of the breast or a different view of the breast. Any suspicious areas which are seen on a mammogram, X-ray mammogram, we are rechecking them with an ultrasound, high resolution ultrasound. And also we have something called as a contrast mammography, contrast X-ray mammography, where a contrast is also used so that some lumps which are very small or very difficult to identify or define whether they are benign or malignant, with their contrast enhancement characteristics, we are able to get a better picture. So these are the latest changes which have happened, or more advancements which have happened as far as screening is concerned. And we have better software also to interpret and to read out these films, which assist the radiologist. Finally, the radiologist's keen eye, an experienced breast radiologist's keen eye is the ultimate. But then there are a lot of tools which the radiologists have now to their disposal, with which they are able to better screen for breast cancers. Even very small cancers, we're able to catch them with the current technology and software that we have.
I think now it's all because of the medical advancements, like you also mentioned, the research and the clinical trials. All the credit goes to them and our experienced and dedicated doctors as well, who are playing a very crucial role in treating, screening, treating, and curing our patients of breast cancer, or let's say any other cancer. Like now we discussed about the advancements of medical advancements for treating and detection of breast cancer. I believe there's this important role of support system for breast cancer patients, right? So, and I believe the whole doctor of panel sits while treating any patient. There's this medical oncologist, oncosurgeon, radio oncologist, and psycho oncologist as well. So, how important is to integrate mental health and support along with medical treatment in care of breast cancer patients?
It's very important to integrate mental health support, because many of these women are psychologically very stressed. They go into depression. There are a few patients who attempt suicide also, who take the extreme step after hearing the diagnosis. It may be completely unacceptable to them. So we as oncologists, we always positively reassure the patient that it can be cured and there are treatments. It's not like an incurable or an untreatable disease, but professional help, mental health help is very important. So we have tools to assess the distress level, the psychological distress level in a patient. And if the distress level is high, then we go on referring them to a clinical psychologist or a psychiatrist. So integrating mental health support is very important. The family members, the caregivers, they also have to be supported, because they are the ones who will be ultimately taking care of the patient. And we often tend to ignore the distress level in the family members or the caregivers. So that also needs to be addressed.
You said it right, ma'am. And since the discussion is going so impactfully because of all the answers and explanation you're giving to us and to all our audience, we do not want to end this. But because we are short of time, I'll move forward to my last question of the session. As we
Yeah.
conclude, what is the most important message you would like to leave with our audience regarding the breast cancer awareness, detection, and protection? As with this session, we aim, as the session name already suggests, that detect to protect. We want to detect so that we can protect our public, not just to treat and everything, just to make them relief or make them relaxed or satisfied. There's like we discussed about the myths and misconception. People say ki, okay, if we go for the screening, we might get diagnosed with cancer. So they have this fear in their head also. So the thing is, we want to clear that air around that it's not necessary. You will get diagnosed with cancer. You will come happy that you do not have any kind of cancer. So that is what we are trying to achieve through the awareness sessions.
Yeah. So the most important message that I would like to convey is that if there is a breast lump, a woman has to check herself, which is called as breast self-examination, at least once a month. If there is a breast lump which is suspicious or which she feels is abnormal or has been there for has not been there earlier, and it's she's able to feel it new, just recently she's able to feel it, she has to immediately get herself checked, preferably by an oncologist. And if screening mammograms have to be started by every woman at 40 years and above, and in some high risk women we may choose to start it a little earlier, the screening. But the usual age for screening for the average risk woman is 40 years and above. The first mammogram has to be done at 40 years of age, and it has to be repeated once in every year. And once in every year, at least, examination, physical examination by an oncologist and reading the mammograms is very important. And maintaining a healthy lifestyle, like avoiding high carb, high fat diet, and taking more protein, and having a balanced diet, and also a regular physical exercise of 30 to 40 minutes a day, at least for 4 to 5 days a week, is sufficient. And it's very important to do those, because that helps in maintaining an ideal body weight. Keep the stress levels also low by resorting to techniques like fine arts, meditation, because stress also plays an important role in creating hormonal imbalance. So this is how we can prevent. And once diagnosed, most important message is don't panic, because
Hmm.
most of the time breast cancer is curable. And if treated in a scientific way, which is backed by a lot of literature, lot of scientific evidence, using those kind of treatment strategies and plans will ultimately give the best results. And we'll be able to cure most of the breast cancers which are from stage 1 to 3. Curing stage 4 may be a little difficult, still possible in some few exceptional patients, but 1 to 3 mostly they are curable if treated in a proper way. So please start the treatment, diagnosis and treatment only at experienced centers. And people should not get misguided by unqualified people. That is another very important problem in our country. People should go to proper centers which are used to treating breast cancer patients, and they have to be managed there right from the time of biopsy till the end of treatment.
You explained and gave us a very strong, clear message. What all can be, a added factor on for being at risk of breast cancer, and how can we avoid a healthy and ideal lifestyle we can lead to avoid all these things. Thank you so much for this amazing session and awareing our public about all its and bits about breast cancer, because your insights and expertise matters a lot for awareness on this important issue. Thanks a lot, ma'am, for giving your time for this.
Thank you for giving me this opportunity to share my views on this platform. Thank you very much.
Thanks a lot. Thank you.